everybody, and welcome back to block 4. You've all done a tremendous job this far. What we'll do is we'll just cap over what we've done this year this far. So in block 1 we looked at treatment outcome measures such as SF36 and MyMop and how these could be implemented into your clinic. In block 2 we discussed the current paradoxes and limitations of acupuncture research. And in block 3, we examined 4 RCT articles and compared those to stricter guidelines. Now, block 4 is a little different. We look at instead the practical use of research. So this block consists of 2 parts. So the first part is for information you can provide to potential clients, and the second part is for a more knowledgeable professional audience, such as co-workers or professions in your field. So the goal of the first part of the assignment is to produce a synthesis of information that will be useful to this prospective patient who may come to your clinic asking for information on the effectiveness of acupuncture for the particular complaint that you selected back in block 3. So be sure to explain this in plain language, so write it in layman's terms or everyday terms, but don't make it overly simple. So you can either select to present this as a patient handout, a newsletter, a newspaper article, or website page or pages. Remember, to achieve this, you'll need to be using your own clinical data that you've been collecting in the student clinic over the course of the year, along with the summary of research papers that you have found in block 3. So this is what to do. So try and integrate it with your small business course in such a way you could use your business theme, like your logo, your business name, and even the color scheme. So if you choose to do a website or a brochure, think about how you may be able to use this in your own clinic. You could find some examples online, such as YouTube, or we've provided links under this video. There's one from the British Acupuncture Council. Now, that website's a really good one. You can also have a look at Deborah Betts or Jane Littleton's or Acupuncture Today websites. They're all really good examples also. And there's also links we've provided for those. So the word count for this part is approximately 1,000 to 1,250 words, plus any graphs or graphics you choose to incorporate. Part 2. Keep in mind for this part you are producing something you would give to someone in the profession, such as fellow colleagues or shared with other health professionals. Please include a short introduction or a background of the complaint you've chosen, and both biomedical and TCM terms. Also include how acupuncture may be effective for this complaint. So you need to include your MyMop data. To do this, please explain in both written text as well as graphical form, for example, using a bar graph. Please also provide a short conclusion. Remember to keep to the academic format and the academic language. Include the research discovered from your selected articles, what you found from your MyMop data. Were they similar to each other or not? Why did you think the findings were different? How well did the researchers reflect your clinical practice, etc.? A good example is a literature review in the articles. So the case studies such as acupuncture literature review results in grant and the Cochrane articles. There is a link to do this on the forum. For your MyMop data, how to summarize, analyze, and present the results. This is well explained on the website by the University of Bristol under the frequently asked questions section. From that page, you can download the MyMop spreadsheet template, and it's in a Word file, or the MyMop sample table. So the word count for this part is approximately 2,000 to 3,000 words, plus your graphs and charts. Now, you have all the materials you should need. We can discuss any difficulties or ideas on the forums. And now please remember that forums and draft submissions go towards your participation marks. So that's 5 marks for each, totaling 15 marks. If you can submit your draft, if you can't submit your draft on time, please apply for an extension before the due date. I think this assignment is really practical, and I think you would actually have a little bit of fun doing it. I hope so. And I want to wish you the best of luck. And yay, this is your last block. So go ahead and do it, and I look forward to seeing your forums. Thank you.